Hi, Therese. Congratulations for this big effort in the community.
Thank you.
And also the opening of the pediatric service.
Yeah,
That's
it's
amazing.
wonderful. Yeah.
Yeah,
The
congratulations.
pediatric service has opened a year ago, but this is the first time that with the development and delivery of our women's health services,
Uh-huh.
we also were able to take care of a lot of pregnant women.
Yeah.
And we were able to to bring the newly born child into care
Yeah.
immediately with
So
the pediatric.
that's being like holistic and continuous
Yes.
in the healthcare program.
Yeah, and we're hoping that the child really is surrounded by care in the context of the life cycle, as he goes from infant to teen to to adult.
Yeah.
And as he becomes senior. That's the whole concept of the community health center. To
Amazing.
Take care of people's lives from birth to grave.
Oh my God. Yeah, that's a lot of work for you and for everybody.
And it requires a village to put it together.
Right,
Because,
right.
It is important that the community shares with us the kind of environment that will really make people understand the importance of primary care.
Yes.
The importance of not seeking help only when they're sick and having to go to emergency
Yeah,
rooms and being hospitalized.
Yes.
Primary care is where we keep people as healthy as possible for long as possible during life cycles.
Right. Are you still being threatened by the budget cuts this time? Definitely, yeah.
It is not just threat, it's real.
It's happening.
It's happening.
So how are you coping? How do you exist? Continue to exist.
We will continue to provide the services according to the best of our resources, as
Yeah.
well as we intend to bring the issues to more of our city and our state officials who will have the means and the wherewithal to really take care of the New Yorkers who are being served by community health centers.
Uh-huh.
We're not alone in this.
Yeah.
All community health centers depend a lot on Medicaid. And
Yes.
with the severe cuts on Medicaid, a lot of community health centers may not even be able to stay open. And things like that, those kinds of policies have very not only current and severe consequences in the moment, it can have decades of impact.
I know.
And that means we may not have healthy individuals, using preventative care, but we'll have more and more going to emergency rooms or
Oh my
urgent
God.
care in order to take care of their episodic issues.
Yeah.
Not one that keeps them really attuned to the latest way they can keep and care for themselves and keep healthier lives.
Are you also tapping funding from private organizations, foundations that are into health mandates?
That will be part of the requirements of keeping us alive
Yes. Oh my goodness.
and well.
Yeah. And also, I remember when we had the last conversation that the big threat is the outbreak again of, God forbid, the HIV epidemic because of the budget cuts. Are we still on that
There has
fear?
There has been progress in bringing down the rate of mortality and the spread of the epidemic because of the new developments in the biomedical development of bringing in pre-exposure prophylaxis.
Yeah.
However, it's still a problem to have 38,000 and more still, becoming HIV positive on an annual basis. That's a whole lot. While it's not in the millions, it is in the hundreds of thousands. It still is a large number of people, and having HIV services cut, it can create a basis for people not having resources, and therefore, the epidemic can go wild again because there are just no resources available for people.
Right. So, what do you want to say to the legislators and local officials to keep community centers like Apicha alive?
One is we serve their constituents.
Uh-huh.
It's very important that they look out for health well-being
Yeah.
and well-being of their constituents. Second, that we cannot do it by ourselves. We need the city and state officials to work with us, to plan with us how all of this disruption can be mitigated. And it might mean really trying to figure out as well where to get resources from places in terms of corporate taxes, places where what's called perhaps a lot more really looking into are we going to send all of the New York taxes to the federal government?
Oh,
Or,
there's that.
There's all of those thinking that's going on. But right now they're doing that, and also the most important thing is for these elected officials to see to it that providers, doctors, and health centers are protected also legally. And because if we are going to take care of the people, we've got to also be protected by the state laws, because it's not just cuts, it's a whole lot of harsh policies that is being implemented on our immigrant brothers and sisters as well as our transgender community.
Oh my God. So hang in there, Therese, and thank you for your leadership.
Thank you.